Hey guys, it's Dr. Justin Marchegiani here. Today's video is going to be on urinary tract infections. This is a major issue, and a lot of women that have these concerns, they're just thrown on antibiotics, which can set their gut up for a whirlwind of symptoms down the road. So what's the root cause of a urinary tract infection? So first off, we did a podcast this morning on it, so head over to, we'll put the link right down below, justinhealth.com, and make sure you subscribe to the podcast. You click down below, we'll have the link there as well. Make sure you look at our most recent podcast on urinary tract infections. But 5 big things that affect urinary tract infections. Number 1, inflammation in the body. The more inflammation we have, a greater chance that bacteria and critters are going to grow, especially in the gut, as well as the urinary tract. A lot of similar bacteria in the gut tend to also be the similar bacteria in the urinary tract. E. coli is a big one. Klebsiella, Pseudomonas. The big one's E. coli, though. So the healthier our gut is, the stronger our immune system is, because that's where the majority of our immune cells live. So that's going to help prevent a lot of these critters from growing. But then number 2, if we have gut issues and we give antibiotics, that may set us up for more of a dysbiotic rebound overgrowth as the antibiotics knock a lot of the bacteria down. So really important there. Number 2, refined sugar is going to feed a lot of these critters. So keeping the refined sugar down. Inflammation 1, refined sugar 2. Number 3, pH is primarily going to be what shifts that urinary area. So when that urine pH goes more alkaline, it raises, that can affect bacteria, making it more hospitable for them to grow. So if we increase inflammation, we feed a lot of sugar, and we increase that pH and make it more alkaline, yes, you heard alkaline. Alkaline pH will actually make it more hospitable for a lot of that bad bacteria to grow. So good bacteria like Lactobacillus acidophilus literally translates to acid-loving. So having good healthy bacteria, it actually spits off specific acids that lower that pH and make it harder for these bad critters to grow. This is really important. So good bacteria, especially the Lactobacillus reuteri and Lactobacillus reuteri, and there's one more, not the Paracasea. It'll come to me in a minute. But the reuteri is a big one in helping that urinary tract and helping keep that pH down and really out-competing a lot of those critters. Next after that, I would say could be yeast, because other yeast issues, yeast can have a similar feel as a urinary tract infection. The big differentiating factor is going to be pain during urination, because the urinary tract's what's affected. And of course, urinary tract infections left untreated can create bladder issues, which is essentially interstitial cystitis, as well as pyelonephritis, which is kidney issues. So bladder infections or urinary tract infections can work their way up. So that's why you want to stop it in its track before it becomes a more serious infection. And then I would say after that, we hit the probiotics, we hit the foods, 2 different kinds of foods, we hit the pH. I also would highlight hormones. Estrogens and birth control pills, which are primarily estrogen-based, are going to make the pH more alkaline. So women that are on birth control pills are at a higher risk for yeast or for urinary tract infection. So we talked about pH earlier, but now we're hitting it from the hormone side. Hormones are going to have a big impact on raising that pH and making it more hospitable for a lot of these not so nice critters to grow. So natural solutions that we like to use, we can do unsweetened organic cranberry juice, we can do D-mannose, we can do GI Clear 3, which is a nano silver particle, uva ursi, various berberines. These are phenomenal natural solutions to help address it outside of some of maybe the dangerous antibiotics that are in the fluoroquinolone family, which would be like essentially the Cipro is a big one, ciprofloxacin, levofloxacin. These are going to be antibiotics that have known side effects to affect the mitochondria in a not so nice way, and even have side effects known to affect ligaments. So really bad things. You want to stay away from them if you can. If you're going to go the antibiotic way, talk about maybe going a macrobid or another antibiotic that's going to help the urinary tract, but not be in that fluoroquinolone family. So if you have to go that way, try to find a side substitute. Maybe macrobids is a good option. Speak with your conventional doctor about that. But again, if you want to dive in deeper and get to the root cause, because it's very rare you just have a urinary tract infection beyond that, right? So you want to get to the root cause. Of course, hydration is going to be a big one. Making sure you urinate after intercourse is a big one. Getting the hormones right is a big one. Getting the diet and the inflammation right. And then also making sure you have good natural treatments. Also, D-mannose is another big one. Make sure you have good natural treatments lined up, so if you have an issue, you can go to those in your back pocket. Let's dive in here. Wow, I thought more alkaline better. Yeah, actually not necessarily. Not necessarily. Hey doc, your lifesaver question off topic. I have a ferritin and serum level of 805 and a TIBC iron cap. I don't see any levels there. I mean, I see serum level at 805. So you want to look at ferritin. You want to look at iron saturation. Iron serum are all good. If you see it high in your guy, then you want to just get your blood drawn. You can just do a nice comprehensive blood test. You could just get blood. All those are good options. I'm 18 weeks pregnant. I have a cough, stuffy nose. Any remedies you can recommend? The easiest thing I would do is just do like a nasaline with the xylitol and just suck out your nose, or at least inject water through your nose, and that flushes out the sinuses. And then you could always do something like ginger tea. Ginger tea would be great for your throat, very soothing. You could also do some apple cider vinegar shots, and that would be a really good option. That would really help the gut. Remember, apple cider vinegar is acidic too, so it'll help kind of kill a lot of that bacteria as well, which is really helpful. I also like the for throat, I have a little bit of a throat issue. I'm trying to channel my inner Barry White today, but in general, I use the On Guard. Actually, no, these are the Thieves throat drops. They're lower in sugar, clove, couple of really good antimicrobial herbs. Of course, I'm sipping on my ginger tea here for the day, and I took loads of astragalus, vitamin C, and some other immune-boosting nutrients, reishi, medicinal mushrooms, etc. What's the longest you've seen a person through a Candida die-off? Weeks, months? I mean, it depends. Most people don't, Candida tends to not be the main issue for most people. It could be a big issue, but a lot of people have other bacteria or other infections that could be part of the root cause. If Candida is a big issue, we just have to make sure we fix all the other hormonal issues and digestion issues first. If you're kind of coming at things here, Ashley, and you're not fixing the root underlying issues, and you're just killing things and you haven't fixed digestion, there's a lot of hormone issues, then it could be a big immune stressor on you just going after the Candida by itself. So make sure, as we chat, we'll continue to get things lined up so we can be most effective in how we knock things out. All right, excellent. Great questions, guys. Any other questions, feel free and let me know. If not, I'm going to go work on another video after this, and we'll have it posted hopefully tomorrow morning. Really excited about that. Anything else? I'll let you guys chime in. Oh yeah, and regarding that other probiotic, let me figure out what that other species was. I said the Lactobacillus reuteri, and the other one is the Lactobacillus rhamnosus. So rhamnosus and reuteri are excellent for the vaginal kind of urinary tract area. They're so close, so getting that in there intravaginally can be very, very helpful for shifting pH. Dr. J, what do you think about gastroparesis, slow stomach emptying, how to fix it? Yeah, I've done a couple of videos on this. Gastroparesis, the more inflammation we have in the gut, the lower enzyme levels, the lower HCl, the more SIBO or bad bacteria or H. pylori or fungus, it's going to disrupt our gut. It's going to activate the sympathetic nervous system, and it's going to slow down motility. The slower motility is, you're going to see things like gastroparesis, which just means gastro, and then paresis more means like paralysis, right? So there's natural wave-like contractions that move food through the intestinal tract. And if we have that gastroparesis happening, typically that increased sympathetic nervous system response, that decrease in migrating motor complex, and then the food just sits in your tummy a lot longer. So natural things we can do are enzymes. We can do hydrochloric acid, but be careful. If it sits there too long, sometimes people can get burning. We can also do ginger or other digestive bitters to stimulate digestion and to stimulate gut emptying. Those are some great ways. But then outside of that, you want to work on fixing whatever gut stressors are in the intestines and making sure the food's really cooked well and pre-digested so it's easy on your tummy. How long does it take to get stomach acid back to normal when supplementing with HCl? It depends. It depends what the cause of why your stomach acid is low. Is it just because you're eating when you're stressed, and it's a simple diet and lifestyle and supplement change, or other underlying infections and long-term stressors that have really let's say, knock down your gut's ability to break food down. If it is, you're going to have to do some testing. Maybe look at your hormones because they play a huge role in activating your fight or flight, sympathetic or parasympathetic nervous system response. We need good, healthy parasympathetic stimulation so we can have good digestion. I've been eating dinner 3 hours before going to sleep, and I wake up at night or in the morning still feeling lousy with food in my stomach, especially in burp, and feel the food there. Yeah, so you probably want to make sure you're going at least 4 hours before bed without food. You probably want to sleep on an incline too, and then you also want to do the natural bitters to get that moving. Excellent, very good. I think I answered all the questions, y'all. All right, I'm going to go work on a video here. You guys have a phenomenal day. If you enjoy it, put comments down below. Let me know your experience with UTI issues. And thumbs up helps the YouTube algorithm. All right, y'all, have a phenomenal day. We'll talk soon. Take care. Bye.